Okay, good morning everyone, and welcome to our Family Hubs webinar. My name is Andrew Laird and I'm the Managing Director of Mutual Ventures, and I will be chairing today's event. Mutual Ventures is a consultancy which specialises in supporting public services to be better and more sustainable. We work across a whole range of areas like children's and adult social care and primary and community care. We're delighted to be co-hosting this event with the Family Hubs Network, and the co-founder of the network, Lord Farmer, will be saying a few words of welcome and introduction after me in a couple of minutes. Family Hubs are a model of delivering public services at its most local level possible. They bring together the public service professionals and communities to provide support to those who need it the most. Across the country, the response to COVID-19 has shown how powerful this type of integrated, ultra-localized support can be. And we're really pleased to say today you will hear directly from three areas, the Isle of Wight, Doncaster and Essex, who have designed and implemented their very own versions of the hub model. We will also provide you with some guidance on how to explore and develop your own family hub. 90 minutes is long for a webinar, but to be honest, the three case studies were all so good that we didn't want to deny you the chance to hear from any of them. So please keep listening. During the webinar, unless you are a presenter, no one will see you and you won't be able to speak, but you can submit questions. Please do this via the Q&A function at the bottom of your screen, and we have 20 minutes at the end set aside for responding to questions. There are over 170 people registered to attend this webinar, so it's very unlikely we will get to everyone's question, but we are preparing a Q&A document which we will send to everyone after the event later this week or early next week, and that really depends on how many questions there are and how hard those questions are. There's no need to take copious notes or screenshots, as we will also be sending out the slide deck along with the Q&A responses. We will also be recording the webinar, and we will make this available as well, and you can share that with colleagues or even watch it back yourself. Last thing is a quick reminder to our presenters to remember to turn your cameras and mics on and off at the appropriate time, and please do your best to keep to time because we do have a packed agenda. I will give you a 2-minute warning to help with your own time management. So that's all the housekeeping from me, and I really hope you enjoy the event. And it's a pleasure now to introduce you to Lord Farmer.
Right, am I on?
You are, yes.
I'm on now. Good morning, everyone, and welcome. And thank you, Andrew, for your kind and informative introduction, and to Mutual Ventures for working with us so enthusiastically on this webinar. I'm really pleased to welcome so many participants today and who have made the time to join us. I appreciate the opportunity to explain why I, someone who's been trading metals in the city for actually over 50 years, founded the Family Hubs Network with Dr. Samantha Callan, who is speaking later. Why we want every community in all 4 nations of the United Kingdom to enjoy the benefits of family hubs, so all families who need support can access it. Just to give you a flavor of the benefits of family hubs, one director of children's services successfully turned around a struggling social work department by adopting this model. He told us that far from local authorities resenting central government pushing for this, they would welcome some kind of direction because, he said, family hubs is an idea whose time has come. That was very heartening for me to hear, as I've been working on this policy really since about 2006, when I helped to fund the Centre for Social Justice's Breakthrough Britain report. Samantha chaired the family work for that report. One of her key recommendations for tackling the high levels of family breakdown in this country was the opening of family hubs in every local authority area. I describe them as somewhere families can go where someone will have the answers. Early help front doors people can walk through when they sense family issues are slipping out of control. Places GPs, NPs, teachers, others can refer parents to when there are concerns. The term family hub means different things to different people. Centres which operate as a family hub might be called an integrated hub, a children's hub, an early help hub, or still be referred to as a children's centre or family centre. So events like this can help bring clarity to the term. I should just mention Samantha and I had a slip of the tongue yesterday when we called it a family hugs centre, but perhaps that shouldn't be kept as a title. Samantha and I founded the Family Hubs Network to connect those who run existing hubs and to help those who want to open them to evolve and to improve their practice by seeing what others are doing. We also argue hard for the spread of family hubs by increasing awareness among national and local policymakers and commissioners. I try to talk about family hubs in the House of Lords whenever I can and include it where appropriate in all my policy work, such as the prison reviews, which I've carried out for the Ministry of Justice, which were to strengthen prisoners' family relationships. By helping to grow a bottom-up movement, we have a strong foundation for saying to the government, this is a solution to problems families face, which would benefit every department of government. You should get behind this groundswell of change. It is not an overly prescriptive solution, but a set of principles to work to locally that could transform outcomes for families. We are beginning to see interest across the government, such as in DWP, the Home Office, Justice, communities, even the Treasury. Our push at central government level is given momentum and shaped by events like these. It's great to bring together people on the ground who wake up every morning thinking about the families they are supporting to bring about lasting change. By giving a platform to 3 local areas who have switched to family hubs, we want to encourage you that this model can play a key role in the transformation of your families and communities. We hope this event will fuel your energy and passion for our shared goal. I'll now hand back to Andrew to get us started. Thank you.
Thank you very much, Lord Farmer. So I'd now like to introduce our first case study. We'll be hearing from Simon Deere and Rachel McKernan from the Isle of Wight team. The Isle of Wight Family Hub is a really innovative model which combines universal, targeted and intensive early help. And they've also embedded services like Job Centre Plus and Citizens Advice within their hub. So it's a really interesting model. So Simon and Rachel, over to you.
Good morning.
Good morning, everybody. Thank you for the opportunity for us to share our experiences and to learn from yours. My name's Simon Deere. I'm the service manager for strategic development and commissioning, and I've worked for the Isle of Wight for nearly 20 years, working kind of within this area.
Hi, and I'm Rachel McKernan. I'm the Assistant Director for Children's Services for Barnardo's in Hampshire and Isle of Wight. And it's been our pleasure over the last 6 years to work in partnership with Simon and the Isle of Wight Council to shape and develop what we call family centres here on the Isle of Wight, because that's what families told us they wanted them to be called. So we've been asked to give you a snapshot of the journey that we've been on as a kind of partnership and in the development of family hubs. So Simon's going to start by telling you where the journey all began.
Okay, we can trace our perhaps journey back from around 2006 when we established our Children's Trust and through our Sure Start Children's Centres. It's very much our early help is as much about a mindset with agencies and organisations, as well as an approach and an offer and a way of working rather than simply a service. It's also helped us to help agencies understand if they work together as part of an early help offer through a family centre, we can provide more support for families to make sustainable change than if we were working separately. I think that the part of the learning we had on the journey was children's social care were the most sceptical about what early help was, what it could do, and actually did it have anything to do with children's social care. But as we'll see through our journey, that actually became full circle, really. So in 2013, our children's social care were deemed inadequate by Ofsted, which was a shock to all, but actually there were some green shoots already there from our Children's Trust and our early help approach. And this is a quote from Ofsted, that actually there was some positive impact in terms of the early help, which actually started to change some of the mindset of our social care colleagues, that actually there might actually be something in this early help offer through our family centres. Okay, so in 2014, we had another Ofsted inspection, and we moved out of inadequate and became requires improvement. And again, I think this underlines how early help, not only is it essential for families, actually in terms of how services improve what they provide, is essential as well. So again, Ofsted found evidence that the way we commissioned early help actually, proved to be an effective way of providing that early help in local communities.
Okay. So in 2015, the Isle of Wight Council recommissioned their early help services, which had previously been commissioned as separate services, and brought them together. So that was the children's centres, the parenting support, early years home support, and the troubled families programme. And the thinking around that was that families often experience multiple interventions at the same time, or they received handoffs. So you went from one service into another. So they commissioned the early help hubs, they were called at that time, as 3 separate locality lots. And the model, which Barnardo's developed in partnership with the local authority, was that there would be one family and one hub. So everything that a family would need would be accessible from their one family hub. And that would be through universal, with a focus on the early years, but also 0 to 19, then targeted help and intensive family support. And the notion around that was at universal, one family would get everything they needed from one hub, which would be a known and trusted place in their community. At targeted intervention, one family would access support through one hub, and they would have one plan, which is the integrated targeted early help plan. And the Isle of Wight already had in place a good bedrock in terms of professionals trained to complete, as they were known, CAFs at the time, Common Assessment Frameworks, but now known as early help assessments. And then at an intensive level, one family would have one hub, one plan, but they would also have one dedicated worker who would ensure that all elements of that work was being undertaken. So unlike a lead professional who would coordinate, the family support worker from within the early help hub would actually undertake that work with the family to a goal-orientated and outcome-focused family plan. And right from the start, as Andrew mentioned, services were embedded firmly within the early help hubs. So health visiting, midwifery, Job Centre Plus, CYP counselling was brought in, and other third sector providers. And in order to ensure that everyone brought in and everyone understood the benefits, we ensured there was a family support worker for every school in the locality, and we had a link to every preschool setting to ensure that everyone was kind of aware of the new model, but also of the interlinkages and the ways that we could work together. And that worked really well. It was not without teething problems, and bringing everybody on board to recognise that they're part of a wider early help system was at times challenging. But we made good progress in those first couple of years. In 2017, we experienced the requirement for a 15% reduction in core funding, which I'm sure is something everybody is aware of, the kind of necessity sometimes to cut your cloth. But actually necessity can be the mother of invention. And so we took that time to look at what was really working well in the current model and then develop opportunities to build on what was working and innovate when necessary. So we worked outside existing commissioning relationships, and we brought in additional funding which supported the early help offer from the CCG around neurodevelopmental support. And at the same time, Isle of Wight Council established the Early Help Board, which was multi-agency to steer the future, and our first early help strategy and action plan was published. So with regards to the changes we made, we targeted our resources at that point so that the paid resource within the service offer was delivering targeted interventions, and our universal offer was delivered by an enhanced volunteering service and by building community capacity and utilising the assets that were already there in our communities and ensuring that they were brought into the early help comprehensive offer. We also affected cost efficiencies by centralising the management of the 3 hubs into one central management, ensuring there was dedicated management for centre, but also the targeted early help and intensive family support, and only opening our spoke sites when they were needed. And we also innovated, so being aware that the wider children's services landscape were not so confident in completing early help assessments or undertaking the role of lead professional, we introduced what we call virtual lead professionals who support and build capacity and facilitate that out in the wider community. We worked with health partners to establish direct referrals from GPs into the family centre, and we also increased co-facilitation to make sure that we were working alongside our partners. Simon.
Okay, through our partnership arrangement that we have with Hampshire County Council, their director is our director, and so in terms of the senior management team, with a lot of hard work, meant that we actually got to good in our last inspection, which is fantastic for families, but also for us as well. So we were
Apologies, sorry Simon, that's your 2-minute warning. Thank you.
Okay, thank you. So the impact of our early help offer, was really evident through the inspection. So for us, it meant that we'd achieved the approach where we weren't having this tumble dryer of families going round and round in terms of referrals, waiting list assessments. Actually, that was the evidence that our early help offer, was good. Okay, Rachel.
So we've continued from that and built on that and looked at how we can integrate more into the offer. We've called this thinking and working outside the box. So we've incorporated the parental conflict programme within the family centre and the wider early help offer. We are now ACE aware and trauma informed and responsive across early help services, and we've worked collaboratively to draw on additional funding that we can bring in. So we have 2 mental health support teams which will sit in that wider early help offer that will due to deliver in January. And we also worked very closely around ensuring there wasn't a cliff edge of support with the ending and the tapering out of the Troubled Families Phase 2. And we've also worked extremely hard in COVID-19 to ensure that families access support, and that is still ongoing. We have maintained all elements of delivery through a blended and alternative offer.
And just to conclude in the last 60 seconds, our next step is to ensure that all agencies and services understand what their contribution is to the early help offer, and that is delivered through family hubs, so whether that's adult services or any other service. So that's our next step. So thank you.
Thank you very much, Rachel and Simon. That was really informative. Now it's time to hear from Alison Tomes from Doncaster, and I would recommend that you pay attention to the work that Doncaster have done on their performance framework and on measuring outcomes, which is really interesting and also really robust. So Alison, over to you.
Good morning, everybody. It's a real privilege to be here today. So I am Alison Tomes. I'm one of the locality service managers for Doncaster Family Hubs. Just to give you a bit of a background around Doncaster, so we are a metropolitan council in South Yorkshire, and coal mining was formerly a major industry, and our pit closures were in the 1970s and the early 1980s. which caused some economic difficulties, and now we are a strong service industry in Doncaster, and 60% of our children live in the most disadvantaged homes within the UK. Next slide, please. So we just want to give you a little bit of our journey as well, because 10 minutes it will go very, very quickly. So in 2015, some of our children's centres were de-designated and we moved into a hub and spoke model. In 2017, we then used some influencing strategies to rebrand the children's centres into family hubs. And the vision for Doncaster Family Hubs were designed to bring services together to work with families from conception through to childhood and into adolescent, delivering those services in an integrated local offer. In 2019, we started to, very similar to this presentation we've heard before, obviously it is really integrating early help and all the services that work with children and families within the local area. But we really wanted to develop the integrated working much further in 2019, and we're still on that journey now. So we are looking at services really becoming rooted in place. So actually, we all belong to that place and those people that live in that place. We really focus on whole family working, and we are really focused on bringing professionals in the community together again and having that connectiveness. And the family hubs allow us to bring all those agencies and all those community diamonds together. Next slide, please. I just wanted to give you a bit of an overview of the structure of family hubs in Doncaster. Like the previous presentation, we've gone through significant change as well and reduction in funding, and this is how we've structured them in Doncaster. So we have a core team, and that's the locality service manager, a family hub manager, a family hub coordinator, and then an early years coordinator. So the team was building on from the successes from the outstanding and good children's centres we previously had in Doncaster, and other services have come into that fold. For example, the young carers. We also have quite a few number of students that come through from different universities to work within the early help offer, and we do have social work students coming through as well. The coordinating role for the family hub is around that building element and making sure that the buildings are used by lots of different practitioners and partners to deliver services within the local area. And I just wanted to show you then the range of partners that we've got co-located in the physical buildings, but also delivering services within the local area. It's not finished, this list, by far. We've still got a lot more to add, and I've got some ideas from the previous presentation, so thank you for that. So it is a growing bank of professionals that are working in and through the family hubs. Thank you. So we were asked to look at how we measure our performance. How do we know what difference we're making to children and young people in the community? So we are building on from the Children's Centre Inspection Framework. So we decided way back in 2017 to continue using that as a starting point, really, of measuring how good we were. And we've built on that to include, obviously, the other elements of the family hub offer that we're delivering. So we do have a quarterly performance report, and our performance report focuses on how much have we done, how well have we done it, and what difference do we make. We've got a whole range of ways of capturing outcomes and outputs. It's huge, and because we don't have a dedicated outcomes framework as such at this moment in time, we link into lots of other outcome frameworks. We take the data from lots of different sources, and we're linked into lots of different governance boards really to get that information. We use a quality assurance framework, we use evidence-based tools, we use case studies, we get feedback, we have lots of audits, we have quarterly evaluations with our parents, and we also continue doing the yearly parental satisfaction and impact survey. That means that we are still inspection ready under the old Children's Centre framework, because we did ask the question nationally whether, I know the inspections are on hold, and we asked the question about whether we could move away and develop our own framework. We were told that whilst they were on hold, we still needed to bear those in mind. So it'll be very interesting to look at how we develop that moving forward. So just wanted to give you some examples of the type of things that we cover really. In terms of those for the Children's Centre Day, you'll understand that participation actually was quite key in terms of counting, to look at the number of people that were members, number of accessing, the number of sustained engagement. So we still do that predominantly with our 0 to 5s, but we do count footfall over for all the age groups. And we know that we've got a 4.5 out of 5 satisfaction rating over the last 3 years. and 97% of parents, and we've got a huge footfall, would recommend family hubs to their friend or family, which is really important to me. In terms of health and development, again, this is just some examples of some of the information we gather so that we know that we're making a difference. And I haven't included all of them, so apologies for that. But we know that in the last year, we signposted 185 people. So anybody can walk in the door. It's a go-to place within the local community. Anybody can walk in and get that information, advice and guidance. And if we haven't got the service available in that locality, we are able to signpost appropriately. We have 38 different types of service delivery and 22 different professional heritages working in and through the family hubs delivering these services. For children 0 to 5, the EYFSP is really important to us in terms of measuring that impact, and we have quite extensive impact analysis to look at those children that do come into family hub services actually do a lot better in their average point scores against all the early learning goals. So we can prove that over the last 3, 4, 5 years as well. We've recently taken part in an EIF case study around speech and language, which really shows the benefit of the multi-agency working in the family hub to improve speech and language for young children. We have individual learning journeys which show baselines from children from start to when they leave us, showing that progression. We know we are reducing obesity, we are increasing the breastfeeding rate. We've achieved the breastfeeding at stage 2 and just going on to stage 3. And I just wanted to give you some of our data in terms of our evaluations. So over 2,000 evaluations were completed last year, and 72% of children have learnt new skills. 74% of children are now following routines. 63 of those are becoming school ready. 83 of parents report improved understanding of child development. 33% of parents have improved mental health, and 21% of parents felt they had better access to local services. And I just wanted to give you a bit of a parent feedback there. I'm sure you can all read that, but actually it's that whole wraparound care really that we offer children and families in the local area. Next slide. So family stability, we did break our performance reporting up based on the parliamentary report about family hubs. So we do report on health and development, employment support and childcare, family stability and supporting families with complex needs. So in terms of family stability, this is where we link in our early help outcomes and our local solutions outcomes. So just to explain what local solution means for us in Doncaster, it's really about that early help. So before we have to make a referral into what we would call our front door for a lead practitioner and an early help assessment, it's those quick fixes that where a family could walk in and say, I've got a problem with this, how can I get that help and support? And we've got a small team of people there with different professional backgrounds that can help that without making too many referrals or filling in too much paperwork. And that's what we're exploring in Doncaster at the moment, how we move that forward to reduce the demand on the front door really and get in there much earlier.
Alison,
we're also leading on.
Apologies, that's 1.5 minutes left. Thank you.
Okay, brilliant, thank you. We're also leading on the reducing parental conflict. So one of the beauties around the family hubs is that the relationship-based practice that we have in place, we have got really good relationships with lots of different agencies, that multi-agency approach. So we're able to deliver that training and skill of the practitioners. Again, we've got the Stronger Families data. We have counselling in the centre for the older children as well, and there's some feedback there from a young person who explained why counselling helped them. So we've got that feedback. We also use the outcome star to measure impact, which, sorry, you just moved on quite quickly there, but we have the outcome star, which helps us to look at from an early help perspective. Actually, families are coming in at a certain point. Where are those gaps and what could be put in place universally to help families? So home and money has been a huge issue in one of our areas, particularly over COVID. So actually we're doing a lot more about reducing families in debt. Sorry, next slide. So during COVID, we were deemed as essential services. So 5 of the physical buildings stayed open for essential health services in the local areas, which was really positive for families. We have redesigned our services. The virtual world is really helping us out with some of the group-based interventions, such as parenting and the early years groups that were taking place. We're undertaking so many welfare calls. We're supporting our schools actually during the summer holidays. So any vulnerable children that are identified by schools, we're actually following that up with weekly phone calls and support should needed. And again, we're really developing that local solutions group and bringing those agencies, those community assets together to look at how we support families. And again, just some parent feedback there, just to show you how we've helped out during COVID. And a thank you. That was very quick. We have so much to talk about and so much to take forward. We're still developing, but thank you very much for this opportunity.
Thank you so much, Alison. That was a fantastic presentation, and I think anybody who's listening in who has tried to develop any sort of innovation knows that the evaluation of that and capturing the right information is really critical. So it's a real pleasure to now introduce Samantha Callan, who's the co-founder and director of the Family Hubs Network. I used to think that I was a big proponent of the Family Hubs, but Samantha's been championing this model since 2007, so I'm a relative newcomer here. Samantha will be talking about some of the foundations of the Family Hub model, and also how Family Hubs help solve problems at a system level. So Samantha, over to you.
Thank you so much, Andrew, and good morning to everybody. I'm going to explain how Family Hubs bring together 3 decades of learning about solving family-based problems, summarise what families can access in and through these hubs, indicate the outcomes Family Hubs are pushing to achieve through integrated working and the early help front door, the need, as already mentioned, for a Family Hubs outcomes framework, and emphasise Family Hubs cost effectiveness. Family Hubs solve key problems. Now, looking at this first at the family level, families are not getting the support they need when and how they need it to address or prevent adverse childhood experiences related to poor family functioning and to prevent the need for costly late intervention. Now, everyone here knows that the issues underlying poor family functioning are typically complex and require a whole family approach. This often needs to draw in non-resident parents, extended family, and the wider community to achieve sustained progress. These issues include, well, practicalities, low budgets, poor housing conditions, unemployment, serious personal debt, disabilities, but also parents' lack of confidence around setting boundaries, which makes the whole job of parenting very hard, and many had patchy experiences of being parented themselves. Other relational difficulties in the family, such as parental conflict, mental health problems, unresolved trauma and adult life, which again can make parenting really tough. Trauma a child has experienced, perhaps through witnessing domestic abuse. And we know that unaddressed, these can lead to children's educational underachievement and disengagement, and then crime, or poor mental health, lack of well-being, poor physical health, including addictions, and ultimately these all undermine life chances. Parents' own physical and mental health is affected. Their ability to be productive, to progress in work, to be healthy, to contribute to society, these all suffer when key relationships are not functioning well. Every family is different and each local area will have particular needs. So the Family Hubs network does not specify exactly what a family hub should deliver to qualify. And the hub is not the site everything is delivered from, has already been said. But we do say Family Hubs are the early help front door families can walk through to get help. So very quickly, what might be available through this front door? It's already been mentioned, early years health and parenting support. So all the perinatal health and early years services most families need. So the classical children's centre offering, which ideally includes birth registration, because this gives hubs the birth data they need to plan services, but also accessing the family hub early alerts new parents to other support, reduces any stigma associated with going through the door, and Bench Hill Centre in Manchester found that 100% of young parents who registered their baby's birth at this centre returned, which is just what you want. Parenting across the whole 0 to 18 age range, and often family hubs are the access point for help up to age 25 where there are special educational needs and disabilities. So that includes access to trauma-informed and mental health services for children, adoption, fostering, kinship care support, child-to-parent violence programs, and ways of engaging dads. Youth hubs can provide safe hangouts for young people where they can access trauma-informed services, and they're places parents can go with worries about drugs, county lines, gangs, etc., and get help to interrupt these lethal pathways. And the information they provide is intelligence for criminal justice agencies too. Couple relationships, domestic abuse services, reducing parental conflict services. These are two different programs focused on different people, obviously. Support for separated families where conflict is still a major issue. Other adult support for alcohol, drug addiction, gambling addiction, debt counselling, welfare and benefits advice, employment support, adult education such as language classes. Now, helping families solve their problems can require solving a system problem. So it does prevention well, and it harnesses community engagement, because the family hub is not just a set of services. What is key is someone coming alongside the whole family who can help them address the bespoke, help them access the bespoke support that they need. It was the 30th anniversary of the 1989 Children Act last year. And those who lamented an insufficiently changed landscape for needy children pointed to the lack of a focus on prevention, despite this being the cornerstone principle of the legislation. The Act specified every local authority shall provide such family centres as they consider appropriate in relation to children within their area. So families would receive help way before reaching thresholds for statutory child protection. Now, on the positive side, a range of other success factors have been honed over those 30 years, which will enable family hubs to fulfil the preventive intention of these statutorily mandated family centres. Because to work well, family hubs require establishing multidisciplinary teams, integrating their offer with existing service pathways and infrastructure, relational practice, taking a trauma-informed approach, building community capacity, statutory services working seamlessly with early help. Because at the end of the day, it is all about changed lives, and family hubs need to demonstrate they are meeting local needs, as the Isle of Wight and Doncaster have already outlined, and Essex will do too. So the spotlight has to be trained on the way family hubs work, on system evaluation, and specifically on outcomes delivered by integrated working, outcomes delivered by that early help front door, and how to measure these systematically. We've already been talking to Doncaster about creating an outcomes framework for all family hubs. But system evaluation, rather than just programmatic evaluation, is where the government is saying we and they need more evidence. So that's why the hefty research fund of £2.5 million announced in the March 2020 budget is really welcome. And in our conversations with government, it seems clear that this money has not been diverted away due to COVID. So we're going to be recommending that they commission theory of change evaluations in a set of local authorities to demonstrate the effect of the systemic change which has family hubs at its heart. Now, this bit's a bit nerdy. It won't last long, I promise you. But a theory of change is a theory or explanation of how and why an initiative works. So a theory of change evaluation of a family hub is a systematic study of the links between its activities, outcomes, and the social context. So this requires being really clear about those intended outcomes, these activities the hub expects to carry out to achieve them, and the contextual factors that are going to impact on the ability to achieve them, the potential to achieve them. End of nerdy bit. Okay, so I'm going to end on the $6 million question of cost effectiveness. Family hubs could be terrific if they are a more expensive way of achieving a set of outcomes than other alternatives. They might be an affordable luxury. So every local authority that has moved to hub model will obviously have a different story, but commonly we've found savings made by reducing the number of children's centres and delivery sites, co-locating staff. And one county council told us co-location achieved a 20% reduction in estates cost, a 15% reduction in IT infrastructure costs. Prioritising community engagement and outreach and providing a service without walls. So rationalising buildings means staff can significantly increase their ability to reach, engage, actually work with local families rather than being tied to staff in buildings. Savings flow from working in a multidisciplinary way, freeing up highly trained and more expensive staff to focus on those with the greatest or more complex needs. And other areas provide help, but have made that shift in a more or less cost-neutral way, or with the help of earned autonomy from troubled families and existing budgets. So all of this is why we are not asking the government to fund a massive kind of Sure Start 2 infrastructure project, but we are asking for seed funding for local authorities through a 4-year transformation fund every area could bid into as part of post-COVID recovery. To sum up, the problem we are trying to solve is the lack of accessible family support, that known and trusted place in the community that the Isle of Wight mentioned. So if we don't have that, then we're not going to prevent the poor outcomes that are costly in human and financial terms. And we have been grappling with the systemic challenges needed to address this for some time. And the bottom-up solution of family hubs has emerged as an evolution of the Children Act 1989 Family Centre. We have learned an enormous amount since then about how to deliver a preventive approach, particularly the need to work in a more integrated way that is hand in glove with the community. And done well, there are clear savings to be made. This need not break the bank. Family hubs have to show that they can deliver family transforming outcomes across the major areas of need in an area. So it's not about prescribing how they work, but being clear about the principles they need to work to, and as I keep saying, the outcomes. So I'm going to end on Lord Farmer's quote from the DCS of a very successful children's social care department, and the quote's already on the screen, who told us, family hubs is an idea whose time has come. Thank you so much.
Thank you very much, Samantha. And also just to say thank you to everybody who is sending in questions. We are gathering those up. There are already a lot of questions, so we're not going to get to them all today, but we will, just to remind you, we will be sending out a question and answer document alongside the slides. So what I'd like to talk to you about now is it really dovetails with what Samantha was just talking about, and is very much around the practical elements of exploring and implementing a family hub. So any of you who have implemented any sort of transformation within a council will know that there are a number of ways in which you can explore it. But I think for family hubs, this makes sense to us. So there are 3 phases really. Explore, which is where you think of what the idea is, where you identify the problem. The business case element, which for most of you, to get funding and to get an idea approved, you're going to have to develop some sort of business case, and then implementation. So if we start with explore, the first thing obviously is to set up a project team, and this has to have a small group of people who are really passionate about this idea. Then importantly, you need to identify the problem and develop the vision. Now for each different area, the acute problem that you're facing and trying to solve will be different. So you need to identify what the problems are, look at your data, identify what it's costing communities, what it's costing the system, Are there specific geographies within your area where the problem is most prevalent? And then you need to identify a baseline. So what exactly is the problem that we are trying to solve here? And once you have that problem, you can get people together to start thinking about what your vision is. So what are we going to try and achieve by exploring this family hub model? So this is where, this is a little bit geeky as well. So the best place to start is to define what we call user personas and pathways. So a persona would be a typical example of a person or a family who is really struggling. And you would capture all of the characteristics of that typical family. And you may have a whole range of those personas. And then what we would typically do, we've supported a number of areas to do this, is to get a big table or a virtual table, which there's plenty of digital tools where you can do that, and to actually map out a typical journey of a person. So in a typical week, which services do they interact with? Which services do different members of the family interact with? What are the handovers between services? Where are the gaps? Where are the areas where once you've identified what that person or family's experience looks like, where are the gaps? And typically, if we weren't in lockdown and we're starting to emerge from that now, we'd be talking about a big piece of paper on a table with lots of post-it notes on it. And what that does is help you understand the existing and current experience that a person or a family has. Then once you've got all of that information, you need to think about what a better pathway would be. How could services work more effectively together to avoid gaps and to avoid areas where it's quite clear that a person is being let down? So you spend some time for each challenge developing what that ideal pathway looks like. And it's only at this point where you start to think about who needs to be involved in your family hub team. Because through this exercise, you will have identified which individuals, which services are required. And at this point, the exploration phase, what you really want to end up with is a high-level design of what your family hub might look like, and be able to explain it to people and show that you've been through a proper process to ensure that it's addressing the problems which are particularly acute in your area. Then it's on to business case. And this is what we all need to do if we want to get funding. So there are a number of different models for business cases which different councils use. We tend to use the 5-case business case model, which is structured in a way that it answers the strategic question, as in how is this contributing to the overall strategy of the council, the economic question, which is how does this fare in terms of a cost-benefit analysis, a financial case which looks at how much it will cost to establish, how much it will cost to run to make sure it's affordable, a commercial case, which is where you start to look at, do we need partners for this? And a number of our case studies today involve partners. So how is that structured? What contracts are required? And then very importantly, a management case, which is how on earth are you going to implement all of this? Because it is complicated. Then you'll need to share that business case with the key people who are required to approve this. So more than likely a decision maker in the council, perhaps somebody in the community health trust, perhaps somebody in the police, depending on what problem we're trying to solve and what team you've decided that you need to put a really compelling business case to them and be really clear about what you're asking them for and what problem of theirs this is solving. That's the key thing. And then a very important point to be clear about at this stage rather than later is that you are asking these leaders to allow their staff that will be involved in this to act in a very different way. So it isn't just going to be business as usual. It's not just window dressing around public services remaining within their traditional silos. You're asking these leaders to allow the teams that are identified to work together in a very different way, and that is absolutely critical. Then it's on to implementation. So to develop anything with success, you need a pretty detailed implementation plan, which will cover everything from the physical establishment of your hub, the transfer of staff, if that's appropriate, engagement with service users, but really importantly, and I haven't mentioned this yet, but it is a key thing all the way through, engaging with the frontline staff. Now, I haven't mentioned it up until this point because it may not be absolutely clear up until this point whether you have permission to actually engage with the staff who may be involved. So it could be that if you're piloting something like this on a small level, it's at this point that you start to put together your team. And the very important element of this is the right leader. So somebody who really believes in the model, somebody who is passionate about it, and somebody who has good experience of solving some of the problems that we're talking about here. And then it's on to thinking about who specifically would be on that team. And we would very strongly recommend interviewing people to understand whether they are the type of person who is willing to act differently and isn't just going to want to try and continue what they've always been doing and bring that into the team, because this does require a different way of working and a more collaborative way of working, and an ability to be willing to try things which perhaps don't work and learn from that and try something else. And remembering that we're probably dealing with problems that individuals and families have that nobody has been able to solve for years, possibly decades. So the idea of trying something and it not working is not the disaster that it might sometimes be presented as being within the public sector and every sector, really. I think it's really important to keep it simple at the start. So don't let the perfect become the enemy of the good. This is a model that you need to just really get going with and allow it to evolve over time. So important thing is just to get started, start working with people, and your model will develop and any wrinkles will be ironed out over time. Then an important point is to focus on culture, and I've really covered a little bit of that already, about that ability to try different things, to support each other as a team, and to be willing to accept that everything that is tried may not work. And finally, and this goes back to the Doncaster example from earlier, it's really important to gather the data and track what happens. There's no point 12 months down the line realizing that you're now being asked if it's working or not when you haven't collected any baseline data and you're not collecting the right information as you go. So that was just a whistle-stop tour of an example of how you could explore a family hub. We've been through this process with a number of councils, and the result and the shape of the family hub has always been very different because the specific problems that they're dealing with are different, the environment in which they're operating, and the level of existing collaboration between agencies, between the NHS and the council and police and others, is maybe starting from a different baseline as well. So it's a good process to go through, and the result will be a family hub which is very specific to your area. So I'd now like to bring in the Essex team. So that's Adrian Coggins and Richard Comerford. This is a very ambitious model which includes a range of providers working together, including specialist community health services. So it's a very innovative and ambitious model. So Adrian and Richard, over to you.
Good morning. Hopefully you can hear me. Good morning, Lord Farmer, Samantha, Andrew, and thank you, Rachel, for handling the slides today. My name's Richard Comerford. I'm the Managing Director of Essex Child and Family Wellbeing Service, and I'm joined by Adrian Coggins, who's the Head of Wellbeing and Public Health Commissioning for Essex County Council. I'm going to begin the presentation, and Adrian will come in at the back end. Just a slight warning to you all, there's quite a lot of, a number of slides here and a lot of detail. So some of the slides will be skipped over, but please feel free to contact me if you've got any questions. My details at the end of the slide pack that will be shared with you. Thank you, Rachel. I won't go into the detail here, but the last strapline or motto that we apply sums us up, and it's a little bit Kennedy-esque, but it's this: striving to improve health and wellbeing outcomes for children and families in the community, for the community, and with the community. It's a motto that we hold dear in Essex Child and Family Wellbeing Service, and it sums up what we're about. Next slide, please, Rachel. The model that we're delivering as Essex Child and Family Wellbeing Service is unique, as Andrew's alluded to, in that it's co-commissioned by Essex County Council and West Essex CCG. And in fact, the bit that Essex County Council commission is also unique in that they've commissioned integrated public health nursing from their Healthy Child program alongside the early help offer that is the traditional children's centre offer. That in itself is unique. But then if you throw in West Essex, the children's community health provision, and in that it's paediatrics, speech and language therapy, children's nursing, all sorts of other therapies and so on, it makes it a particularly unique model. And it starts with the commissioners coming together with a clear vision. If I could just take a step back, Rachel, sorry. As you can see from this illustration, Virgin Care is delivering this contract in partnership with Bernardo. So we are the primary providers and we have a clear mandate in what we need to deliver. But we also have a number of subcontracted providers, and it's clear within our contracts with those subcontracted providers that we're all working to the same aims and the same goals, and aiming to achieve the same outcomes as set by the co-commissioners. Equally, as we work in partnership with multiple agencies that work with our service, both in our family hubs and the communities, it's important that we emphasise that we are working towards these clear outcome measures. So the outcome measures are owned and shared by all parties, those that are directly commissioned from this contract and those that we interface with that are serving to benefit the greater good. Next slide, please, Rachel. There's a little bit of detail here about the contract, but it's a large contract, and Essex itself has a population of just over 1.5 million people, and it's a big geographical area. There are 38 what were children's centres, if you like, 38 family hubs. Of those 38, there are 12 distinct family hubs, one per district. So the other 26 are spoke model, if you like, outreach delivery sites. So they are traditional children's centres in a sense, but they are the smaller outreach versions. So that each district has its own large family hub. And I liked Samantha's comment earlier that, you know, family hubs are essentially an estate, they're a building, but the offer that's delivered from them it transcends the building and goes into the community, and it's a service without walls. So particularly, it's a particularly important point for areas in urban and rural communities where you've got outer urban and rural communities where there's big distances between family hubs and delivery sites. So a lot of the work that we outreach deliver is in community halls and church halls and so on. So it's important to recognise that not like inner cities where everyone can access a site. We have to understand that we do need to have a service without walls. Moving on to the next slide, you can see from this illustration the size of Essex, and the different colours represent the different districts. So each of those districts has one large single family hub that is the centre of that district. And as I say, out from there are outreach delivery sites. And before I go on, it's another important point to recognise that across this large county there are 5 clinical commissioning groups and now 3 STPs, and by that very nature, it brings complexity in joint working and strategising when it comes to children's services. At the moment, we have the challenge of trying to not only communicate with the 3 STPs and the CCGs within them, but the other local authorities that link with those STPs. So in the north, it's Suffolk, and in the west, it's Hertfordshire. So it adds more complexity in trying to achieve the goals for your local people, a local population at a community level. The next slide, please, Rachel. This illustration is the illustration of our model. On the left, you can see the green symbol is the family hub, and it's connected to the district, and there is the governance structure that sits above it, both by the local authority as the commission, the primary commissioner, and ourselves as a service provider. The service on the right, the illustration on the right, just demonstrates where we place children and families at the centre of what we do, local communities and neighbourhoods around that, and we service, like GP primary care networks do now, we try to service the same secondary schools, feeder primary schools and communities, and work in partnership with local agencies. Next slide, please, Rachel. This illustration is of our workforce and how we work across the pre-birth to 19 age range, including up to 24 for young people with SEND. Along the top, you can see unique roles that we've introduced, and things like volunteer coordinator, healthy schools engagement workers, community engagement workers, that aim to bring in our both to outreach into our communities, but also in-reach, bringing partners into our service model and build the relationships and partnerships that we need. If we can just go to the next slide. This illustration is really aimed at our health partners who may be on this call. What we are trying to illustrate here is historically public health nursing and children's centre provision and health provision has worked, as we heard earlier, in silos. And often the activities of children's centres have been either overlooked or undervalued. And what we see historically is a huge sort of cyclical movement of patients between GP practices and acute hospitals. And I think, as Samantha said in her presentation, we have a huge role in early help and prevention. And if our model, if we can move to the next slide, Rachel, shows that if we not only just co-locating organisations and staff, but if we also conceptually bring together with the same people together with the same aims and ambitions, we can consume our own smoke, we can build resilience in communities, upskill communities to look after themselves, and prevent a lot of long-term problems, both health and social care problems that in this illustration should reduce dependency on healthcare, on hospital care, but also in local authorities produce dependency on social support through either housing benefits and various other dependencies. So at this point,
Richard, sorry to interrupt you. 2 minutes. Thank you.
I'd like to hand over to Adrian now, just to talk a little bit about how the early years review led to this model and how the partnership element was introduced. Thanks, Adrian.
Thank you, Richard. So cramming this into 2 minutes, but we can obviously discuss more in the panel, hopefully. So lots done, lots still to do. We've joined up previous children's centres, early years activity with Healthy Child programme activities, and Richard and colleagues have built a fantastic integrated workforce from those previous services. The next steps, if we're serious about outcomes, is working with other parts of the system to commit to the same outcomes and define what their contribution is in a coordinated approach which has to transcend organisational boundaries or specific contractual requirements. I think Simon from Isle of Wight spoke about a mindset, and that's how we achieve it in a nutshell. So family hubs give us an opportunity to physically manifest joint working towards shared outcomes. It's not just co-location, although that's a useful part of it. It's not about changing physical use of a building, and it's certainly not just about reconfiguring organisational boundaries. It's got to be a response to a cultural mindset of absolute commitment to bringing all parts of the system together to achieve the same outcomes and identify their unique contribution to that outcome. So next steps are to, I think, embrace the broader determinants of health model, critical to underpinning good well-being, and to manifest that locally. So in addition to, for example, messy play and traditional activities, of which I'm a great fan, we need to introduce activities that Doncaster and Isle of Wight have previously spoken around, such as working with the DWP, for example. But we've got to mainstream that. And we should look at things like the work of the Robert Wood Johnson Foundation, which shows us that 30 to 40% of determinants of well-being are socio and economic. So this is not just an add-on, this is a core part of how we achieve the outcomes if we're serious about achieving those outcomes. So family hubs are a continuum of possibilities, from a narrow programme of activities through to that broad programme which covers the wider determinants of health. And we need to recognise the inescapable data set, Michael Marmot, Carol Black review, that shows what the true determinants of well-being are. And Family Hubs is an opportunity to focus on those in a well-defined geographical area with a well-defined broader join-up of different activities. So it's the hub, isn't it? The clue's in the title. The Family Hub is the centre of our effort. So we need to radiate broader, more inclusive circles out from this, which include a broader range of stakeholders and can operate across a wider range of life domains. I think it's not just words and philosophy and vagueness. We need crystal clarity and forensic analysis on, firstly, the problem definition. What is the problem we're trying to address? And I don't think we do that anywhere near well enough collectively. And then secondly, a robust process to generate both well-defined shared outcomes and well-defined proxy measures and milestones towards those outcomes. And I would say we need a lot more national discussion on these, because some of the measures that we've got around some of the activities that we are delivering, they will not give us a close enough indication of how we are doing towards achieving some of those longer term outcomes. So whatever we do, we need to spread bet more on the diversity of activities we do, and Family Hubs are an opportunity to do that, again, in a well-coordinated, defined geographical area. So we need national debate, I would say, on how we convert Family Hub activities into a broader programme of work, which gives us a more assurance of a stronger link between some of the short-term activities that we're undertaking and some of the longer-term outcomes. And I just finish in by throwing in what I think was the most important thing I learned in my public health masters, where somebody once said to me, make the important measurable, not the measurable important. It's much harder, but it's necessary. Thank you.
Excellent. Thank you so much, Adrian and Richard, for that. So let's get straight into questions now. So let me turn my light back on so you can see me. If I could just ask our panel to keep their answers really succinct, and we'll try and get through as many of the questions as possible. So let's start with this one. Quite a few questions around asking for advice on getting the buy-in from key stakeholders in the area, and this might be across agencies as well. So could I ask Simon or Rachel to kick off on that one from the Isle of Wight?
Yes, certainly. I think, Rachel, would you like to go first, or shall
I? Okay, yeah, I'll start. I think the key thing is being absolutely clear what it is that you're endeavouring to achieve, and therefore, if you create a clear vision that people can buy into, but also that they can recognise the joint benefits that working together will achieve. And I know that there are so many competing demands that sometimes it's really important to ensure that you focus down on what it is that you're trying to achieve and that vision. And once you've created that, then it's kind of hearts and minds and marketing, really.
Thank you.
I'd just add to that it's taking a whole family approach that I think Samantha mentioned, in terms of families are an interacting system. So if a single agency addresses a single issue with a single individual, actually it's going to have limited effect, but actually by working together in a whole family approach, it's much more effective in terms of sustainable improvements.
Thank you very much. Alison, is there anything you'd like to add to that? This is
No,
Alison from Doncaster.
Hi, thanks. Yeah, I completely agree with all of that, and actually having some service level agreements in place or some joint protocols of how we can work together to improve the outcomes for children and families, which has helped us in Doncaster with our social care colleagues, for example.
Okay, excellent. And then Adrian, there's a build on this question where quite a few people have put in that they often find it quite difficult to get on the same page between councils and health services. And you've obviously achieved some of that. So what advice would you give to people who are looking to have a more integrated approach across council services and the NHS?
I think sometimes it's good to be quite emphatic about the need to do this. And, if you ask people the question, do you want these kind of outcomes? Do we want to reduce child poverty? Do we want to reduce kind of health inequalities? Everyone's going to say yes to that. and then if you swiftly follow that up with, well, based on what we're collectively doing at the moment, are health inequalities reducing? No. Is child poverty reducing? No. That kind of validates the need to work more collectively to achieve it, because self-evidently, what we are doing, generally speaking, in terms of those really high-level outcomes, it is not working. So I think, the need to kind of have a shared solution is self-evident, and sometimes we need to inject some of that evidence that what we're doing isn't working as well as we would like. And I think the other thing is the reason that we got into a joint contract with West Essex Clinical Commissioning Group and the local authority was probably that the single most important thing was sheer bloody mindedness and saying, we are going to make this happen. And there were lots of people who didn't want to. There were lots of people that said, well, what are the contractual implications? What are the kind of governance implications? And there came a point where we said, if we want this to happen, this is what we will do. And, Richard and I, we've had some kind of, disagreements on some of the ways of doing things going forward. But we have a shared appetite for risk. We have a shared appetite for exploration and a shared deep curiosity about what we do, what we need to do in order to achieve these. So this is about deep personal behaviours amongst practitioners, as much as, I'd say, more than around organisations or contracts.
Yeah. Very good. And Adrian, just while I have you there, you're trapped, you can't go anywhere. There's a few questions here around sharing budgets. I wonder, just very quickly, could you make a comment on that?
Well, so sharing budgets is a process, isn't it? It's not an outcome. And so again, there's a question which we were asked was, should we have a pooled budget? And I would say, well, that's not a question which we would be asking. The question we would be asking is, what is the outcome that we want to achieve? What are different organisations or individuals' best contribution to that? And then if you get that together and you're able to take some of the rhetoric around phrases like, we need to take a system approach. Yeah, we get that. We've known that for some time. What we need is some operational methodology to kind of ground that in reality.
Yeah. So,
if we say this is the outcome, then who has what unique contribution to that? Then I think that drives, it removes some of the vagueness, some of the concerns around, a vague question like, should we have pooled budgets? And it makes it a lot more real.
Yeah.
The other thing that also drives very quickly is, I would say that possibly some organisations need to have a bit of a healthy blurring around the edges, around their organisational responsibilities. So again, it all starts with outcome and that shared commitment to an outcome, which is sacrosanct.
Thank you very much.
If I may just step in, Andrew, to add, if I can, really quickly. I mean, I think it is a really important question that the guest has asked. Just to explain what happens in Essex is that it is a co-commission contract. From an administrative point of view, the process of contracting and contract management is led by the local authority, but the process itself is co-commissioned, and every forum, every meeting, every interaction we have between provider and commissioner, it's co-commissioner membership. So just thought it was important for
that's a very good point.
Ask the question to know that.
Much appreciated. So I'd like to bring colleagues from the Isle of Wight back in again. There's a key question here about how you change the organisational culture to enable family hubs to succeed. So
I think,
handle that
Rachel, do you want me to go first?
Yes, please.
I think it's by doing, really. I think in terms of, we can sort of theorize and we can write strategies, but actually it's about the lived experience in terms of the meaning that families give to their experience and the support that they provide. I mean, I'll give an example. We're currently re-tendering, and in the specification, our contact centre and our contact supervisors will be part of the early help offer through our family centres. And that's because I remember once seeing a dad open to children's social care, child and child protection, but his contact supervision was taking place in a parent and toddler group in one of our family centres. So actually he was experiencing what it likes just to be a parent, accessing support, knowing, building those working relationships, friendship networks, rather than actually in a cold building on some industrial estate when we're actually sort of trying to observe and supervise what kind of normal parenting looks like. So I think giving those kind of concrete examples about what difference looks like really helps people understand.
Yeah, that's really helpful. Thank you.
And I would add that that key, and kind of picking up on one of the points in your presentation, Andrew, is really about leadership. I think if you've got the right leaders and you've got the right growth mindset and that kind of risk appetite in, and the recognition that you're going to try something new and it may not work, but it's okay, you know, if that's the case, as long as you learn something from that. And also ensuring that you are fully engaged with the service users and the children and young people, so that their voices, you can then translate their voices to those partners that might seem slightly more reluctant. And it's amazing what a young person or a child's voice can do in terms of winning over even the steeliest of hearts.
Absolutely, yes. Alison, do you want to add anything on culture?
No, again, it's the leadership element and having that passion to drive this forward. For those that have worked in this industry for a long time, we know the difference it can make, and actually it's trying to convince others to find that win-win situation for everybody, and it is difficult. It is really difficult.
Yeah. There's another question here, which is a more practical one. So it's, how can family hubs provide information and signposting to parents and young people following family separation? Samantha, do you want to answer that one?
Yeah, I'd love to, because over the years, and I've been thinking about family hubs, I've been very aware, we've got a lovely Aussie accent from Richard here, that in places like Australia and Norway, actually, they run family relationship centres where, when you're going through the very difficult period of separation and all the wheels have come off the family wagon, the divorce or the separation does not end the conflict, sadly. Often children are still living in a very conflicted environment. They're still feeling pulled between mum and dad, and it's kind of war without end, because once they've separated, often there's no extra support. Now, I've always felt that what Australian relationship centres do, we could do them so easily in family hubs. And in fact, the last evaluation I heard from Australian relationship centres, where they offer mediation and they help parents and things like how to put the children at the centre of what's going on rather than ignoring the needs of the child. Their last evaluation was saying, we need so much more. We need this kind of panoply of help for families that actually corresponds to a family hub model. So let's do it together. Let's put these we've got the Reducing Parental Conflict programme that the DWP are making enormous strides right across all local authorities in England, and family hubs would be a great delivery site, access point for all these services. I'd just simply say practically, there's quite a specialist, the help that parents who are separating will need can be quite specialist, but whoever is on the reception in the family hub, they've not just got to have been trained in how to deliver information, advice and guidance well, so how to assess for domestic abuse, etc. But also they have to understand that kind of almost the quasi-legal territory that's involved. I've already mentioned mediation. They don't have to be kind of a solicitor themselves, but they need to understand with this kind of area a bit more of they'll need to refer on, but a lot of these things can happen within the hub, be referred on from the hub, but this acknowledgement right across the country that this is a missing area of services. And the Social Security Advisory Committee, that very lofty body that advises the DWP, they themselves are saying this is an area we cannot afford to neglect anymore, because child maintenance flow is hampered by lack of relationship help.
Thank you very much. Does anybody want to add anything to that very briefly, because I want to squeeze in one more question?
Just very quickly, I absolutely agree with that. And we actually ask our families about the benefits of coming into family hubs. And we know that from all our evaluations, 61% of parents feel supported by somebody that they trust because they're in that local area and they're faces that they can pop in and see when they need support.
Yeah. Okay. Thank you very much. And then I think what will probably be the final question, but we may have time for one more. There's a really good practical question here, which I think links into the preparation of the business case and trying to make all of this seem achievable. And the question is, how can we make the most of existing infrastructure and estates as we implement this model? So who would like to, would the Isle of Wight team like to kick off on that?
Yeah, Rachel, shall I go first?
Yeah, go for it, Simon.
Yeah. Okay, 2 points I'd make is we identified local community assets in which to site our family hubs so that they were known, they were familiar, there was no negative connotations. They were either nurseries on a school site, in the community centre, or once even in a church. And so we've kind of utilised existing infrastructure. And so our provider, Bernardo's, for our family centres has that on a sort of a peppercorn rent. So we kind of support provision through that. The other point I'd make is actually early help and family centres, family hubs, actually the investment that's needed is often beyond the life cycle of a local government administration. So I think actually how do you kind of secure that long-term investment, hence why ours is all absolutely embedded in our children's trust and our children's approach, and that's one of our constituted bodies of the local authority. So that's how we've secured that longer-term commitment beyond, as I say, a life cycle of local government.
And thank you. Alison or Richard and Adrian, anything to add to that with regards to existing infrastructure?
Yeah,
I guess we're, I mean,
sorry.
Sorry, Richard first and then Adrian.
It's a very difficult question to answer in a couple of minutes because it is complicated and it's all dependent on local, the landscape and need and geography and population. But I think, as Simon said, having family hubs and delivery sites located where they're most accessible in a family-friendly environment is what we're all aiming to do. But it's got to be within it's got to be cost-effective and it needs to be weighed up for that particular area. So I think that's where you need to be working alongside the commissioners, council members, and so on to really do that analysis before you make change, because we've had instances where we've got that delivery sites in areas that are underused, but there's a huge public pressure to keep them there and keep them open. And whilst keeping them open is politically the right thing to do, it soaks up resources that could be allocated to other areas. And it's not just having someone sitting in a building, it's running that building, the estates, the IT costs, all those sort of things. So it's really working out your budgets and keeping the councillors and the local people connected to what your plans are, and you know, communicating. Sometimes difficult decisions need to be made, but those need to be communicated through the right way in a very open and transparent way. But I, as I said in my presentation, I think there are areas where we simply can't afford to have a building, but there's need. But there's a big gap between paying £15,000 to £20,000 a year on a building, whilst we can spend £5,000 and hire a village hall and deliver services from that hall in the same way. Particularly what COVID-19 has proven to us is that we can deliver a lot of our services virtually. So many of our groups and individual contacts are delivered through different virtual programs.
Thank you.
That should continue.
Thank you very much. Alison, did you want to add something from the Doncaster perspective? Just 1 minute, please, if you would.
Just, 1 minute, very quickly. Just that the branding and the marketing of the family hubs, obviously we were really conscious that we didn't want to brand it any sort of organisation, because it's a whole plethora of organisations involved in family hub delivery, and we want families to trust that brand. We've still got some families that are really scared of coming in over the threshold because they think we're going to refer them to social care and take the children away, so we still have a little bit of that culture within some of our communities. So it's really important to brand it something that is really accessible for families.
Thank you very much. So that's the end of the Q&A, the live Q&A session. I'd just like to give my own thanks to all of the panelists and everybody who has attended. We had 170 people attending, non-panelists at its peak, and we've actually held on to most of those people, which is a good sign. So following up from this, you will get the slides. We'll develop a question and answer sheet. There will also be a recording of this, which we would encourage you to share with colleagues. And also we'll send out the contact details of those who are okay with those being shared. But I think at the very least, you all have at least an email from me. To conclude then, I'd like to hand back over to Lord Farmer, who will say thank you and has some final reflections. So over to you, Lord Farmer.
Well, thank you very much, Andrew. And may I thank everyone else who's been involved today. That Simon and Rachel and Alison, Samantha, Richard and Adrian. Thank you all. I mean, it's been a real eye-opener. It's been a webinar, I believe. I'm not greatly experienced in these things, which has been extremely, I think, encouraging and strengthening to the whole idea of family hubs and getting them implemented across the country and having the government behind it. Just to step back a bit, my own, if you like, passion for family hubs really came about by sensing that our society was really centered really on policies which encouraged individualism. And one could see that the results of family breakdown, which we've touched on today in so many complex areas, that they were producing problems for our society, which just built up. There wasn't a policy of prevention. There was more a policy of putting a plaster on a deepening wound. And in fact, just come back from the Ministry of Justice, it was their statistic which they found out that prisoners who received family visits were 39% less likely to reoffend than those who didn't. And this was a sort of eye-opener and in fact, a great encouragement to Samantha and myself and many others to start working on publicizing the importance of families, the value of family relationships, and what were we doing about it. And so we have this family hubs model now, which is bottoms up, which is very much, I think, this word prevention keeps propping up, and it's a very important word. Just you think of domestic violence, which is such a big thing these days. There's different types of domestic violence, but if you've got something like situational violence, there you can work with the couple to actually stop it. And you keep the family intact, you keep the children there, you mention of ACEs, etc. All these things are reduced, and that basic family unit with those relationships becomes a boon to society and not a weight on society. So just to say that I do think that, as Samantha mentioned again, that, you know, that quote that the time has come. This has been a very helpful and encouraging meeting of many different types. Again, it's that working of relationships with one another, which we've touched on. Departments haven't been working together, but now here we all are working to see how we can reduce those walls and work together in the complexity of family relationships. So very well done to everybody. I've been greatly encouraged by your commitment and by your understanding of the problems, that the Family Hubs network is here as a service. We're there to publicize what the various Family Hubs are doing, and to find out what works well, so we can all learn from one another, encourage each other, and come back to supporting families, keeping families together, which I think would be a huge blessing to our nation, but also a huge reduction in expenditure as well. So may I now draw it to a close. Thank you again very much, all of you. We press on, and I'll say goodbye now. Thank you.